Hello, everyone, and welcome to HealthWare's webinar, our free webinar. And thank you for joining us as we continue our webinar series. We're very excited to continue to run these webinars. Now, today's webinar will not last a full hour, so I'm already giving you a gift, the gift of time. My mother always told me to speak slowly and clearly, so I will try my best. And when I managed call centers in the past, I always told my staff that people can hear you smiling. So hopefully you can hear me smiling from time to time throughout the slideshow today, the presentation. For those of you that are new to our webinars, we're using Microsoft Skype Business Meeting, and what you are viewing is actually a video. You're already viewing the video, so it's about 20 seconds delayed from real time. You can pause it if you're interrupted. You can rewind it to replay a specific part if you want clarity. And you can join it back to real time again. So you have a number of options when using this software. The nice thing about it is there's nothing to download on your computer, so you can run it from any PC, phone, as long as you have an internet connection. Okay, today's topic is outcomes analysis for star ratings and value-based purchasing. I'd like to discuss VBP from a slightly different perspective, a discussion of outcomes analysis. Now, in addition to being an excellent software solution for home health and hospice, HealthWare offers an outcome analysis for your star ratings in VBP. So whether your agency is in one of the 9 pilot VBP states or not, outcomes analysis is very important to you because it can also help you improve and manage your star ratings. You have many options when it comes to measuring and managing your outcomes. HealthWare is one option. If nothing else, I urge you to explore your options and find a partner. I hope your partner of choosing is HealthWare, but just make sure it's someone who helps you. A few words about HealthWare. We are a full-service software solution designed for home health, hospice, and private duty. HealthWare is available to be installed on your own servers or in the cloud. Now, the cloud is an interesting concept. Many software solutions say they are a web-based or a cloud-based software. I really encourage you to probe further with them. Exactly what is and where is their cloud? A company that purchases and connects you to one of 3 or 4 servers that have been placed in their garage or basement can technically say that they have a cloud. Scary, right? HealthWare uses Microsoft's cloud called Azure. Azure is both HIPAA and high-tech compliant, which means that no other cloud is as secure as Azure. Now, here's a funny story, but it's true. You've all heard of the iCloud? Well, you'll never guess where that is. It's right. Now, we are one of a handful of software solutions to offer offline capabilities for our point-of-care documentation. Without this feature, you'll need a data plan costing upwards of $30 per user per month. And lastly, HealthWare is the only software solution for home health to offer an outcomes analysis and consulting service for star rating and VBP. With HealthWare, like with most other software solutions, you still have the option to use one of several very good third-party vendors for this analysis, usually for a significantly higher fee than HealthWare. HealthWare can provide you with this analysis whether or not you are a HealthWare client for your software. Okay, now here's some numbers that are not new, but I wanted to share them with you just the same to keep our focus. Based on a census of approximately 100 patients, an agency can increase or decrease their reimbursements by $250,000 or more over the next 5 years. Now, some of you are saying, we aren't in a pilot state, so what do I care? Well, you better care, because your 2015 OASIS data formed the baseline for everyone. Your 2016 results last year can be impacted by 3% plus or minus in your 2018 reimbursements. And your results for 2017, the ones you're reporting right now, can see a 5% impact in 2019. Now, this is very important. VBP is here to stay regardless of what happens to the Affordable Care Act. We've heard a lot of verbiage. Obamacare is going away. It'll be replaced. Who knows what's going to happen to the Affordable Care Act? Some changes will most likely take place. But please be very clear that VBP is here to stay. Now, star ratings are still reviewed by potential clients, whether you have VBP or no VBP. Now, need I say more to that? Sure, your outcomes impact your VBP, but also your star ratings. You simply cannot ignore managing your outcomes just because you are not in a VBP pilot state. Some of you are thinking, well, I have home health compared data or home care compared data, so I'm good. Please keep in mind that this data is 2 quarters behind real time, and it's data that you already submitted, so it's too late to affect your results. At Healthware, we evaluate your scores now and deliver them to you while there is still something you can do about it. Again, in comparing partners to work with you, make sure you find a partner that's able to do this. You take control of your own results, and we help you evaluate processes for efficiency, effectiveness, consistency, and quality. Again, a lot of other partners will help you do this. Determine an action plan based on your data. We help you track your progress. Ask yourself, what do I know? More importantly, what don't I know? Do you have your competitor data? Have you analyzed their data and your own? How can you make changes? What can you change? What can you improve? Now, on this slide, it's a sample of one of our outcome analysis by ICD section. This picture points out a total of 81 patients who were not improved and shows the trend by the primary diagnosis. This is part of our analysis. Now, this slide is showing the outcome analysis by related data. Please note that you have options to filter your data by a wide number of factors, including by patient, by calendar year, quarter, month, and other related mu numbers. While you may be able to easily handle the input of your OASIS data, You cannot effectively manage the VBP process and your outcomes without an analysis partner. And again, there are several very good ones out there, but many are expensive. Being the only software solution to offer this analysis, there are many advantages provided to you. Healthware also offers predictive modeling that identifies the types of cases that might negatively affect your outcomes down the road. So still, you may ask yourself, why Healthware? I have a strong relationship with XYZ company, even though they charge me a lot more money. I like them. Well, Healthware has been doing this for more than 30 years. We're an industry leader in software and value-based purchasing, including outcome analysis. This is all about selecting the right partner, and Healthware has an accomplished record of doing just that. Healthware is a Microsoft Gold competency partner and is a Tier 1 cloud service provider. We know what we are doing and are a trusted source and partner. We have been staying close to the pulse of our industry and speaking with a lot of knowledgeable industry experts, much like yourselves. And we're seeing some very concerning trends. We're seeing an increase in mergers and acquisitions. We're seeing where smaller agencies will not survive in the future. Paper clinical documentation simply will not allow an agency to stay alive. Many consultants and industry leaders will agree with these statements and have. Many have stated so during webinars that we've hosted. So this is not just Healthware speaking. Talk to these people. To thrive means you have to be able to survive. You need a partner. Focus on your competencies, your core competencies, providing superior healthcare services. Allow your partners to help you with other tasks. Explore your options and compare features and costs. Get demos from potential partners. Allow Healthware to show you a demo of our products. Finally, make a decision and act on it now. You deserve the best. You deserve Healthware. Please contact us and we can show you how we can help your agency. Now, I told you this webinar was not going to last an hour, and we've got it right at close to 15 minutes. So again, I hope you enjoyed the presentation. It's not all about Healthware, although again, I would love to have you use our product. The important piece here is that you need a partner. Find one, compare features. I've laid out a number of features that Healthware provides. So now you've got an idea of what we can do. We certainly can give you a demo of our outcome analysis tool. It's pretty cool. I think you might really enjoy what you see. But get demos from other partners as well. Contact them. Ask your software provider, your software solution, what are you doing for me with my outcome analysis and with VBP? They should be pretty aggressive on this. They should be all over the analysis piece of it for you. Yeah, you can certainly use a third-party vendor. You had that option with Healthware also. Compare costs. Compare what they give you on that analysis. And by cost, I also mean the cost to upload the data, because that has to happen, or you're paying for the transfer of data. With Healthware, it's automatic. It transfers all by itself. And being that they are integrated, you will get a much clearer view of your data in real time. not just when it's uploaded. So again, I'd love to have you be our partner, but I encourage you to shop around, compare products, compare partners, ask a lot of questions, but please pick a partner. We want your agency to survive. With that, this is Vinny Giannotti. Again, thank you very much for your time. I really appreciate it. And if you have any questions, you know how to reach me, either by email or by phone. Also, on the right side of the screen is a Q&A feature that you can write in your questions. I won't be able to see them till after I stop the broadcast, but I will see them and I will respond. So thank you again. I just saved you 45 minutes. Enjoy the rest of your day, and I look forward to speaking with you soon. Take care. Bye-bye.